Mr. Good afternoon to everyone. Mr. Rubing is currently negotiating downtown Charlevoix like we all enjoyed doing in July. So he should be here shortly. Jennifer, can we have the roll call, please?
Marcus,
Here.
Roloff, Hankins,
Here.
McInnes,
Here.
Kuntz,
Here.
Pallarito,
Here.
Powers, here. Rubing's on his way.
Thank you. Item number 3 is review and approval of the meeting minutes from June 7th, 2022. I have a motion to approve those minutes. Moved by Commissioner Roloff. I'm sorry, I'm a little tired right now.
I'll
Shirley.
second that.
Seconded by Mr. Pallarito. Any further discussion or corrections? I've known Shirley for 30 years and I could not for the life of me think of your last name. All right, hearing no changes or alterations. Jennifer, can we have a roll call, please?
Roloff, Hankins,
Yes.
McInnes,
Yes.
Kuntz, Pallarito,
Yes.
Powers, yes. Rubing,
Yes.
Marcus.
Yes.
Hello, Jerrison. Thank you for making it. All right, Jen, I have the signed copy here for you.
Okay, thank you.
Item number 4, approval of the agenda. Do I have motion to approve the current agenda?
I'll make a motion to approve the agenda as presented.
Made by Mr. Pallarito.
Support.
I'm sorry, seconded by Mr. Rubing. Any further discussion? Jennifer, can we have a roll call, please?
McInnes,
Yes.
Kuntz,
Yes.
Pallarito,
Yes.
Powers, yes. Rubing,
Yes.
Marcus,
Yes.
Roloff, Hankins.
Yes. All right, item number 5 is public comment. I'm going to read our rules again. The availability of public comment is recognized by Robert's Rules of Order and the Michigan Open Meetings Act to provide for orderly comment from the public. Public comments are welcome and are important to the Board of Health. To that end, the following information is provided. Speakers are encouraged to use the podium and microphone so that board members can clearly hear their message. Before speaking, a speaker should clearly state their name. The chairperson may implement a sign-up sheet for public comment at any time during a meeting if it becomes necessary to better organize a large public turnout. There's a 3-minute time limit for each speaker. Timing will begin after a speaker's name is established. Upon notification that 30 seconds remain, speakers must make every effort to conclude their comments within this time frame. Upon the oral request of a member of the public, a donor who is present at a public meeting and wishes to donate his or her speaking slot to another member of the public, the speaker, and with the permission of the chairperson, which shall not be unreasonably withheld, a speaker may comment for up to 6 minutes, equivalent to 2 public speaking slots. Public comment shall be addressed to the chairperson, not to the health department staff or individual Board of Health members. Speakers should be germane, courteous, and respectful during their speaking time. Strongly worded advocacy, however, is to be expected and shall not by itself be considered discourteous or disrespectful by the Board of Health. If a speaker desires to provide materials to board members during the meeting, the speaker or a designee will give the materials to the board secretary for distribution. The chairperson has the discretion to permit members of the public to speak at times other than those reserved for public comment. These public comment rules will be incorporated with the posted agenda for each public meeting of the Board of Health so that they are readily available to each person who desires to speak at the meeting. The Board of Health expects that each person desiring to speak at the meeting will have read and will comply with these rules. Those are the rules. Do we have any members of the public who would like to address the board? I've been handed a list. Thank you. First up, we have Tracy Skinner. Make sure that mic is aiming down toward you and that it's on, okay?
Is this all right?
Yes, ma'am. Thank you.
Well, welcome, and welcome to the bridge traffic. My name is Tracy Skinner. Many people understand the aspect of public health that they might have seen. This is the public face, often environmental or family health. The wells, septic, food, immunizations, they are out in the community doing the inspections and getting the shots. That only represents some of us. Our staff are married, single, divorced, widowed, recent graduates, or close to retirement. Some have new babies, preschool, school, or adult children, families with chronic health conditions, loved ones in care facilities. We are fathers and sons, mothers and daughters, and grandparents. We shop at the grocery stores, we attend the churches, and eat at the restaurants. We drive the roads and experience the magic that each of the seasons in northern Michigan brings to our commute and to our travel during our work days. Depending on the role that we have varying levels of education and licensing requirements. We are experts in our areas and are respected for how our piece contributes to the whole. We answer the phones and public questions, schedule appointments, provide vision screenings, breastfeeding support, health and nutrition education, dental care, pap smears, medical billing, accounting, IT, and mental health services. We operate a regional lab, have experts in regional and community planning and emergency preparedness. We have staff that maintain and support our buildings and our programs with the functioning of maintaining and purchasing our vaccines and toilet paper, and those are essential functions. And yes, we have environmental health sanitarians and nurses. This agency has a long tradition of relying on evidence-based information and research. Many members of our leadership team hold advanced degrees in public health and have many years of experience. Our families sell and fix the cars, build the houses, work on farms, veterinary clinics, schools, and so much more. We are your community. Now, it's been my experience, and maybe it's been yours too, that sometimes you expect conversations can be fairly simple, only to be surprised that it was anything but. This has been my experience so far with this committee. And the word increase makes your heart beat faster, because where's that money coming from? We are not seeking the actual cost of living or inflation that we are experiencing. Our committee met with our leadership, and it was determined not to be feasible. It is my understanding that the health department is bearing the entire burden of the cost of this proposal. We are proposing that the Board of Health approve the use of identified funds to sustain and retain our workforce, and to recognize that our cost of coming to work and for almost every aspect that touches our lives has
30
increased.
seconds.
I know that you understand that because you've already voted in each of your counties to support adjustments for other employees. I believe that this is a smaller than any of the other proposals that have already been approved. So I look forward to tonight's discussion. I thought this was going to be simple and straightforward, neatly wrapped up, and it makes me wonder what I'm not understanding. Thank you.
Thank you. Brenda Colbita.
Hi, my name is Brenda Colbita, Emmett County. And with the chairperson's permission, I would like to donate my time to Mary Moore this evening.
You may do so.
Thank you.
Mary Moore. You have a total of 6 minutes, Mary.
Talk for Brenda now, and can I talk for myself at the
No,
later
you
time?
have 6 minutes to
To
speak.
talk right now, and that's
Yes.
it?
Correct.
Okay. All right. I'll give it a shot. So there were a number of things that caught my attention as I read through the packet for today. I don't have a pretty speech prepared for you, but I'm just going to kind of tick through them in the hopes that I can offer a little bit of insight from one of your concerned members of the public and hopefully some assistance. On the 3% raise, I have these thoughts. I have empathy for all the economic issues that everybody's facing. You know, my family's facing them, businesses that I know about are facing them. And I certainly have empathy for everybody involved in trying to decide whether to give this raise and how to do it. I just want to remind everybody, like, I worked in corporate America, and in corporate America, success is rewarded. Like, you don't just get rewarded because you're showing up for work. and I want to not beat a dead horse, but the COVID policies that were implemented by almost everyone in the country, including this local health department, have not been very successful. And in the corporate world would not necessarily be rewarded with raises. We had lockdowns, which actually led to a lot of the economic problems that we're experiencing now. It really collapsed the economy, harmed our students, and did a lot of things I probably don't have time to get into. The masking and the vaccines resulted in worker shortages. People didn't want to be vaxxed. People didn't want to wear a mask. And of course, the trillions of dollars of payouts that were seen as necessary by the federal government made was the first real trigger, I think, for the inflationary period that we're going through. So really, the notion that we are rewarding the COVID policies that were implemented the last 2 years doesn't sit very well with me and with a lot of people out in the public. So again, I have empathy. We need our health department. Many individuals in the health department do a very good job. They're very good people. That's not my point. My point is, in the real world, success is what is rewarded, and there is some justice that all of us have to share together the misery of the inflation that the COVID debacle has caused. Okay, so that's the 3% raise. The other important thing I wanted to talk about was the job description of the health officer. And I just have a couple of main comments on this. Number one is, if you don't have to vote today, I would encourage you not to. I would give the public a bit more time to look at what the job description is, because this really does sort of define what this health officer is going to do going forward. And I don't think we want to repeat some of the mistakes that we've had in the past. And myself, I only was aware that this was publicly available, a couple of days before the 4th of July. So that's one point. Also, I see that you're going to look at possibly having a new lawyer. My suggestion also would be maybe that lawyer would want to look at the job description as well. So that was my first point about that. But second, I would say watch your line of authority. I think it should be more clear in the job description that the health officer does report to the board and is under the direction of the board. The board is not just one more entity or person that is collaborating with the health officer to make policy. Instead, the board is sort of the buck stops with the board. And I think that you guys are going to discuss that also, hopefully, when it comes to finances, because for example, even with purchasing right now, that the buck doesn't apparently stop with the board. And I think that it should. So my third point is, I really recommend that you watch out for language in the job description, like, applying standards of medical practice or best practices or commonly accepted, standards, because that sort of begs the question, like, exactly what standards are we going to accept, health standards as a local health department? And did we, what did it work out for us relying in the past on the corrupt CDC and the corrupt HHS and the corrupt WHO? I think that it didn't. And I think the whole purpose of being local is to actually try to be a little bit more independent and independent thinking. To that end, I highly recommend that you partner with or hire, as is permitted under section 333.2435 of the Public Health Code, organizations that can give you a sort of a second opinion or even a first opinion. Hillsdale just started the Hillsdale Academy for Science and Freedom. As you know, Hillsdale's in Michigan, and they've hired Scott Atlas, Jay Bhattacharya, and Martin Kulldorff, 3 really smart epidemiologists who predicted and told the world you should not lock down, you will have economic collapse. So they were people who were right, and they ought to be rewarded. And here they are, associating with Hillsdale, which is in Michigan, and I bet they'd be available to you. And then I would recommend partnering with Dr. Lopato down in Florida, because I think he's an independent thinker too. Last but not least, I would say, let's not blindly pursue Public Health 3.0 with our new health officer. Let's talk to some experts outside of our own little world here and really take a fresh look at how we prevent COVID type experiences going forward. Thank you so much.
I have no one else on the list for public comment. Is there anyone else from the public that would like to comment to the board at this time? Seeing and hearing none, we will move forward. Item number 6 on our agenda is a health officer job description discussion. The committee that was reviewing this has given us a job description in your packet. It's 1, 2, 3, 4.25 pages long, I believe. What's the desire of the board? You want to have some time to go over this? And I personally have not looked at this in great detail.
We've had it out for a couple of weeks.
This is a recommendation from the committee. This is a recommendation from the committee.
Yeah,
Okay.
the history is that, as Rob described at the last meeting, I brought a draft from our HR department. The committee, then Kristen in particular offered some suggestions, which we incorporated. Staff had questions and issues that they addressed, and the HR director put it in the form that fits the health department, all of its job descriptions.
Okay.
We felt, I can't only speak for myself, but I felt that it was a good, solid job, much improved over the one we had before.
I stand corrected. Looking at this, now that I'm refreshing my memory with it, I have reviewed this as well. Does anybody from the board, other than Mr. McGinnis, have any further comment regarding the proposed job description?
I think going through the job description, we discovered several issues that we'd like to take up, but probably would fall into more of a bylaws and or procedures amendments possibly. I know our public comment had mentions things like that, but this is a general job description, not a policies and procedures manual per se. And we did, like I said, we did identify issues that were more germane to policy that or bylaw that would have to be looked at probably deeper, resulting from our work here.
Okay. In Christian, I know you have something regarding the public comment from Ms. Moore. At the top of the page, it does say reports to the Board of Health. Although under general summary, it starts out working in collaboration with the Board of Health. I don't know.
A couple of things that we added that I thought were quite useful, and I probably Jairus is the one to talk about them, but you made 2 additions that I thought were pretty helpful.
Yeah, what I'm drawing a blank on the second one, but I remember the first one is under number 2. I think starting at the word "and" on the last sentence, and communicates all such actions with the Board of Health.
Right. Yeah.
And I think there was one other one, but I'm kind of.
And I can't tell you where it is either, but it was similar. The intent was similar to draw attention to communication, but honestly, as to where it was, I can't remember.
One thing I was curious about, and we made some changes and we've done some revisions. And I know Dan has worked on this too. Sometimes when you go through and you redo a document, it's kind of nice to have it. Here's our old one, and here's some red language that we added with the new one. And just to compare and contrast. And I mean, I don't see that we're in a terrible rush to do this. I kind of would like to see that.
I don't have I don't know who has yeah, we voted to, yeah, we voted to approve it.
Mhm.
Okay, Mr. Marcus.
So my understanding with job descriptions, they're generalized because they're a tool to attract employees. That's the goal for a job description. The policies which my neighbor here has mentioned earlier have to deal with what we have more control of, board policies, and such. But this is a separate document. This is more of like I said, once again, it's a tool to attract somebody. And when you start getting into the weeds about what expectations are as far as rules go, you kind of break that. It's a 30,000 foot piece of paper, so to speak. So I looked at it. I don't see anything that would cause me any alarm, concern. My main goal is attract somebody who is really good for our district to do this job. And I think all the rest of the stuff that we probably agree on doesn't need to be in this document. So I'm okay with it.
I am as well.
Ms. Powers, do you have any input?
I'm okay with it. I like some of the new things that have been put in. And I agree with Christian, we can't have every single statement in here. We'll get way out of control if we do.
Ms. Roloff?
And I know that we have to do this. The big thing is we look, I wanted the ones that jump in with the thing. I don't know if we've had a chance ourselves to really discuss it. We did the one meeting.
We did it. at the meeting.
And you were, I do believe that. Yeah, I'm not on that committee. Right, and so it's a good thing, but I don't think we should just get that input. We should go over it again and take a good look at it. And if there's anything that we. need
Well,
to-
I'm sorry, go ahead.
Well, just to make sure that everything that we really want is in. Because we don't want to come back and have to do it again. So,
If I may, you were on the committee and we have reviewed it. We've reviewed it, I think, twice, and the committee has made a recommendation. I think we have chewed on it pretty well. Staff has,
we need to, we have, there was four.
yeah, but you were one of them, though.
The on the other side of the page too, that I wasn't there. And that would be one, that's all I'm jumping right on it, want to, agree on it. And then the balance. What was the other, I think
Well,
it should be discussed with all three.
okay, and that's our opportunity right now. Shirley, that's to Charlie's point, the committee was tasked with coming up with a proposed job description. They have done so. We have had opportunity to review it. Charlie or Jairus, remind me, and I think this is covered under qualifications, but this is all of the specific wording that's required.
Right out
By
of the law.
statute,
Yeah,
right? Okay.
Christian, at the meeting, Christian said, he wasn't sure about these qualifications because our HR person just put in some general information and I had, in anticipation, I pulled off the public health code specific language, brought it in, and we incorporated it verbatim.
Okay, good. And I think that's wise.
Yeah.
So this is our opportunity. Not that we can't, I'm willing to be flexible with the board's desire as well. I think to Mr. McInnes and Mr. Kuntz's point, here we are. This is what you ask us to do, and this is what the committee has come up with. So if there's any specific tweaks that you would like to make, I think this is a good opportunity, and we don't have to vote tonight. Jairus made the comment that we aren't in a rush to do this, and I would agree to an extent, although this is July. And at some point, we have to post this position. Dan's doing a great job, but we do need to post this position eventually and seek our candidates for the health officer's position. So what's the desire of the board? Mr. Marcus?
Every idea I come up with falls into the category of policy. And whether or not it's valuable in here or not, and for some reason, I just can't find the value of adding what I'm thinking into this, where it should be in the policy, so.
Okay.
I just read it, I just kind of skimmed over it again, based on Shirley's request, I skimmed over it again to see if I missed something, I don't think I'm missing anything.
Okay.
I'll offer a motion that we adopt this policy as recommended by the Personnel and Finance Committee, or not policy, this job description, excuse me.
Okay, it's been moved by Mr. McInnes that we adopt this proposed health officer job
support.
description, supported by Mr. Marcus. Is there any further discussion?
We all agree in agreement.
As long as we all receive our packet in timely manner, I think we should have plenty of time to read it over. If not, then I would expect somebody to have more objections.
Any further discussion? Hearing none. It's been moved and seconded that the Board of Health adopt the proposed health officer's job description. Jennifer, can we have a roll call, please?
Pallarito,
Yes.
Powers,
Yes.
Rubing,
Yes.
Marcus,
Yes.
Roloff, Hankins,
Yes.
McInnes,
Yes.
Coons.
All right. Very good.
I will say that the committee was very productive and I thought it was a good process.
Thank you for the work that you guys put in and getting this done. Okay, item number 7 is request for proposal for legal representation. Looking to see where I have that proposal. Here we go. I believe it's on your desks. It's a request for proposal of counsel and legal services. Mr. Threll, you want to address this briefly?
Sure. And I apologize that was not
And
able
I'm
to get
sure
this.
You're on.
Is it on?
Oh, yes, you
Yes.
are. Just slide a little closer if you would, please.
And don't grab it by the microphone.
And
slide
don't grab it by the neck. Don't be breaking stuff. This is Shirley's house now.
I'll try not to. Yeah, I apologize that was not able to get this together to get in the board packet. So I put a copy on your desk there, but I put a request out to other health departments to see if they had done this. And I did receive one example back, and I took that example and just tweaked it and added some language and made it more specific to us here at Health Department Northwest. So this is a very, rough draft, and really is something just to look through and determine, what you like, what needs to be added. And I think probably a good action for this would be to take some time to look it over and maybe send it to the Personnel and Finance Committee to review and kind of dive into is the way I see the best way to go through this document.
I would agree that we should send this to Personnel and Finance for review. I think everybody from the board now has a copy. You certainly, you just received that copy, admittedly. So Can we have a consensus from the board to refer this to the Personnel and Finance Committee for review and come back with a recommendation?
Yeah, I think that's a great.
Yeah,
idea.
great.
Does that
Great
sound
idea.
good?
Yeah,
Charlie,
Yeah.
Jairus, Matt, Charlie, both on board. Mr. Marcus has a question. or a
Mainly because
comment.
I'm afraid I might forget at that committee. So on page 3, there's a word that says any under the capitals, HDNW will entertain compensation proposals. In
Where are
any,
you at, sir?
in any format, including,
Under 14, after 14 on page
Yeah.
3.
in any format, is that like a electronic format or?
I think it means because if keep going in that sentence, it talks about, the different options like lump sum, retainer, payment on an hourly basis, payment on a.
Yeah, the
per
word
case
any is the only
basis.
thing I find a little issue
Okay.
with. So I would like.
You
must.
strike that one.
More like you must provide this in because we need to get
Okay.
apples to apples, not maybe this, maybe that.
Yep.
We want to know exactly what you're off. Other than that, yeah. I think
In-
the committee should look
yeah.
over.
Okay, I'm not hearing any objection to referring that to the Personnel and Finance Committee. If there is, so please say now.
This is great.
Okay,
Great start. Yeah.
okay, so we have a consensus then from the board that we will refer this request for proposal of legal services to the Personnel and Finance Committee. I'm sorry, I am tongue tied today.
Scott, I'm just curious, maybe Dan knows. Have we done this before?
No.
Or could you find it in the records anywhere? I mean, a
No,
lot of government entities do this every
Sure.
5, 10 years, whatever, you know what I mean? I was just curious if you found any.
I think I can enlighten as far as the history of our legal representation. So we had Jim Young from Bel Air for many, many, many years. And I think when that was set up, even going back into, I think the mid-70s is when he started. And so there was something back then, we don't have it. And then when, right. And then
That's
when,
over 40 years ago. so-
right, exactly. So, and then he recommended bringing on Lisa Vogler, when he was kind of transitioning out, and that's what was done. So there was no RFP done at that time. So, and I think it was really this board looking to do that. And I think, there's a lot of good things in here that, it deals with conflict of interest, hold harmless clause, just a lot of general type things that, should be looked at or addressed, when you're looking at legal counsel. So I think it's a good start with this document. And I think I look forward to working with the Personnel and Finance Committee to polish it up and send it out.
Okay, so Jen, you will put that on their agenda for their next meeting, correct? Thank you.
Yeah, and really quick, I don't think we had set a next meeting. So we'll have to also, reach out and talk about that. And we can just reach out to Rob and see what works.
Very good. Mr. Rubing has presented us item number 8, a review of the purchasing policy.
Yeah, so we talked about this 2 or 3 times, and I've seen it talked about in both committees now. And a purchasing policy doesn't seem to necessarily fit within the bylaws real well. I've looked at 10 different health department bylaws, and a lot of it's not there. It's not, I mean, it might be there in 1 or 2, but the majority, it's not. The purchasing policy is not there. So you've got on your desk in front of you, it's called the purchasing summary for budgeted items, Exhibit 1. This is Antrim County's, and I'm not saying this is the silver bullet for the health department. Antrim County's is 16 pages long. This is the beginning of page 12, just because it's got these cool cool summaries, and page 13's got this little breakout. And I looked at Emmett County's a little bit too. Theirs is 64 pages long, so
Yeah,
a lot of the stuff in here is the same as what it is in Emmett counties.
yeah, I recognized that.
And
Ours was just recently revised, and that's why it's so long.
and I'm not sure that the health department has to be that long, but we should probably have some of this in it in some way, shape, or form.
Well, given the issues that you raised and that Scott raised, when I looked at the purchasing policy for the health department, I thought, well, this is not going to be a matter of adding a sentence in here and addressing something. I don't want to make additional work for the health department in terms of their routine activities. I don't think that's helpful. In the county, we really have to have those thick sets of rules for all the contracts we do. I don't know how they contrast with the health department, but I think in terms of tightening things up a bit, an improvement would be sensible within, as long as it allows the health department to do its work in an orderly fashion, in a predictable fashion. I think somewhere in between is going to be a good place.
Yeah, I mean, in your packet, the policy procedure number 2, the second bullet point says small purchases are purchases less than $150,000, and they need documented rate quotes, but no cost or price analysis. I mean, that's a huge number. I mean, most of our counties are in the $5,000 to $10,000 range under that. And I mean, Dan needs a new pickup, so that's only 45,000. So let's just buy it for him. We don't have to get a quote or anything, you know? I mean,
Right.
It's not good.
I think order is always beneficial. Policies are there for a reason. I agree. I think that although I don't like to give work to staff, I do think there is a benefit to a little more structure. I think everybody benefits from a little more structure.
Important to get staff into that process, so we know what people
Right. But I think we can sort this out, though. I don't think it's impossible. I think it's beneficial. So,
Agreed, Mr. Marcus.
Yeah, I can appreciate that. We have all been conditioned to make sure we are more fiscally responsible in our decisions, and I'm glad we think in that way, because we're dealing with an entity that not just one county, it's 4 or 5 counties, right? So now you got that 10,000 times 5, right? So it's a lot bigger number that we have to look at and appreciate that. It's going to be more no matter what, because it's got a large amount of people it's got to cover. The one thing I want to remind is that type of accountability is not convenient to anybody at any staff level. So we can't expect them to be all, yeah, I want to do this. We're asking to show us on paper the accountability practices they're probably already doing. We just want to see it in a different form. I think that's basically what we're asking with the policy. And of course, there's an expectation that our oversight of dollars, whether they're state dollars, county dollars, or what. So I think that we should take some time and look at this and not jump right in with both feet.
Mr. Coons.
Absolutely agree. There is, the thing that probably industry standards, state or county and work. And we have to keep in mind that the situation like the health department, they need to be flexible under certain situations, emergency situations, tornado and Gaylord, we want to be having call for approval of certain expenditures. We need to find out what the standard is in this industry to accommodate for those circumstances. And then, hopefully,
this is one that's going to take a couple of months, but I think it'll be a worthwhile trip.
Mr. Thorell, you have any input?
No, I appreciate the conversation, and yeah, I think, there are some things that are definitely different from the health department standpoint. Some of the purchases are large. I'm just thinking about the regional laboratory. Some of the equipment is, you could spend $50,000 on one piece of equipment very easily. And then sometimes we have vaccine purchases that are very large. So there are things like that, we would have to, really kind of see how that would work within a purchasing policy.
I think where some of the concern has come up in the past is with legal representation. There were attorneys that were hired that we simply weren't aware of until we were aware of large bills. And that puts us into an interesting spot. We're presented with bills for work that's already been done, and it's hard then to say, well, no, we don't support that purchase, or we don't support that. If that were the position of the board, for example, which I think has been in the past. So maybe we need to have a specific heading for contracting of professional services under this purchase policy. Just my own thoughts. What's the pleasure of the board? What do you want to do with this particular policy, folks? You guys did such a nice job on the job description, Charlie. I'm ready to say. Okay. I think it needs to, well, I don't know when we're going to have specific legal counsel that if we put out the RFP today for legal counsel, we may not have anybody on board, that could specifically review it first. So I think it probably needs to go to committee first for their tweaks, come back to the board, then we could submit it to an attorney for review before we officially adopt it, I think.
Well, if your hint was that you want the Personnel Finance Committee to do it, I'm only one member and Rob's the chairperson, but it doesn't bother me.
Yeah, it's fine. It's something we can take up, absolutely.
Mr. Marcus.
I think that this is such a deep, big subject that I would hope that we bring it as we work on it to the board, rather than have this, here's our proposal, vote on it, argue it all out, because it's going to take some time. And it's a good way for us to all stay in the loop. If we could just bring it to the board as we work on it. Because I got a feeling it's going to take more than one or two meetings.
Yeah, I think that the process is what counts. It's not the outcome, it's the process. The process is good, the outcome is going to be fine. People have individual concerns that have to be addressed. We know what they are. We'll start the process. You will say, it still doesn't address my issue. We'll fix it. I think that's the only way to get to success on this thing.
So do we have board consensus then that we would have the Program and Finance Committee? I said that wrong. Personnel and Finance Committee. I need a couple more committees to think about. The Personnel and Finance Committee review the policy and procedure for purchasing. We have consensus for that? All in favor, say aye. Aye. All right, Jennifer, you get to put that on their agenda also. Thanks, guys.
I do have one question
Sure.
on 7 and 8, and maybe Dan knows this. What is the distinction between items that are received at the Charlevoix location and items that aren't, in checking for damage? And I don't know if you read through those. I can read.
I think there's a purchasing person at the Charlevoix office. Is that accurate or no?
Jen, do you have any input on that?
We are the purchasing in Charlevoix, but
Mm-hmm.
we also distribute to our other health departments. So we count on either the front desk or the clinic, public health techs to let us know if they received all the items, what was on the packing slip, if anything is damaged. And then we go from there, since we're physically not at their facility.
And then those items, once they're received in Charlevoix, they're distributed by,
They
Health
actually,
department staff.
we ship a lot of things directly to the other facilities. That's why we count on them to review the packing slips, let us know if anything's damaged, and then we take care of it from there.
very good. Does that clear it up for you?
Yeah, and the only other thing I was gonna mention when we look at this policy. I'm not sure what the procedure is when you have a large expenditure that's not budgeted. So I think that needs to be looked at. I mean, Scott, you mentioned the legal thing. And the auditor last year mentioned something about it, and I don't know, I'm not an auditor, so you spend $100,000 on something that wasn't budgeted. Does that create a red flag for an auditor? They emailed me something about it and I just said, you know, I'm not an auditor. Yes, this expenditure did take place. We have the bills to prove the attorney fees. It wasn't budgeted, so I don't know what auditors look for.
Mhm.
I'm guessing they don't like that necessarily.
I think, you know, what they do is they look at your purchasing policy and make sure that you're following it. So in that case, with the purchasing policy the way it is, it was, you know, there was not a deviance from the purchasing policy. And I don't know if that was just something the auditor did to make sure that you were aware of the purchase or some of their checks and balances. I don't know.
That's
Or
probably why
the
I wasn't
expenditure.
helpful, because I didn't know what the purchasing policy was.
Right, yeah. So I don't know, maybe Andrea, do you recall that conversation with the auditor? I know that there was one other thing that had to do with the mobile lab unit, and that was the debarment policy. We had a finding on that. And that had to do with like the rules, when you are with federal, grant dollars. And, you know, going through that, you're following all their rules and checking to make sure that, you know, who you're getting the equipment from is not contributing to like, funding Iran type stuff. And there's a whole long list of things that you have to look at. And that was something that was a finding that was missed, which we addressed right away. So. But I'm not aware of the issues with the legal or any issues with legal expenses.
Okay. Any further conversation before we move on from item number 8?
I'd like to propose that the next Personnel Finance Committee be scheduled on a day when it's raining.
We'll get out the crystal ball, Charlie, and take care of that for you. Item number 9, staff reports, Mr. Thorell.
Yes. Okay, thank you. Well, first of all, I want to start out with Amanda Thompson is going to give a presentation on the demographic picture of HD&W, Health Department of Northwest Michigan, and she has a presentation she'll be going through here and get it up on the screen.
Somebody's sharing, so I can't. Thank you. I did get I know sometimes it's easier to see if you would. Perfect.
Sorry.
That's okay. All right,
I
so
was listening to it on the way here.
I will have time for questions at the end, so please save those if you would, so I can give you a picture of this. So I really just wanted to start to kind of recenter us with what is the vision of the Health Department of Northwest Michigan. So our vision really is healthy people and healthy communities. But in order to really be leaders, whether we're formal or informal leaders in our community, it's really important that we understand who are the people that are affected by the leadership roles that we have. Again, whether that's formal or informal. And a lot of the work that we do in public health is this opportunity to impact those that are in our community. And when we really look at that, so what I'm going to go through here is really just what does our community in our 4 counties look like? What is the demographic complexities that we have? Again, I really scaled this presentation back, so there will definitely be some gaps. But as we're going through this presentation, you're going to see that Antrim County is the yellow, Charlevoix County is blue, Emmett County is orange, and Otsego County is green. So as we look at the total births from 2010 to 2020, you're going to see in each of those counties what that looks like. And what you see is an overall general downward trend. So what does that mean in our community? When we think about the births are decreasing, that means our schools have less kids in them. So there's less funding coming, there's less community that have the younger families that are starting up new businesses or workers that we have in our community. So really important information to know as we make decisions. When we look at the number of Medicaid paid births, so these are individuals that are being born in our community that have Medicaid when that mom is going in to deliver. And we're at around 40% in each of our counties. And at Otsego County, well over 50% of the births that are born are families that have Medicaid. And then that kicks over to children. So 0 to 18-year-olds, the number of children in our community today that have Medicaid are almost 50% in every single one of our counties. And so that just gives us a picture of what does that mean as we are looking at the people and the services that we are providing. Other information that we look at, births to mothers who smoked during pregnancy. So this is one of the only indicators in the entire, when we look at all of these indicators, that we are higher than the state of Michigan. So in our 4-county region, we have more mothers that are smoking during their pregnancy. Now you again see a general downward trend on that. This is a huge indicator that we've done a lot of focus since 2014 when the information was first shared. Last time I know we shared a lot about that needs assessment. This is information that is gathered and then services can be provided during this time. Yes, Matt. Correct. Yes. Yep. Absolutely. And if you were to look at just the Medicaid population, so again, almost 50% of our moms that delivered had Medicaid, that is actually even higher. So even higher percentages when you were to just tease out the Medicaid population.
I don't know if you're going to jump ahead, but the impact of smoking during pregnancy is what?
It's great. Yeah, I'm not getting into those kind of details. These are really just a statistic overview, but a higher rate of preterm delivery, low birth weight. The mom and baby have higher risk factors when there's smoking during pregnancy. When we look to our teens, so then this would be tobacco use in our teens. So this is data that is all of our teens do a MiFi assessment if the school wants that information. And so very underreported. So you have to remember that these are teenagers in our schools answering these survey questions. So typically it's very underreported. So the number of students that have used tobacco or vapor products in the past 30 days. Interesting about this 2017-18 data compared to this data 19-20, the number of the vapor percentages have doubled. So one of the things about tobacco, it is the hardest drug to quit. It's really like your gateway drug. It is harder to stop smoking and using tobacco products than it is your other drugs that are out there. Our WIC program participation. So the percentage of children 0 to 4 years old that are on WIC in our communities, over 50% in almost every single one of our counties. So these are the families that we are serving here at the health department. When you also think about children, this really gets into that mental health violence side of it. 1 in 4 kids are exposed to family violence in our community. 6 in 10 children are exposed to some other sort of violence or abuse within the community itself. 4 in 10 children are direct victims of at least 2 violent acts, and 1 in 4 are direct victims of at least 5 violent acts. And this is right within our community. We are seeing this as well. When we look at childcare, so one of the other big things when we think about children in our community is the ability of licensed, safe childcare providers. And you're looking at the numbers of these. So Otsego County does have 60 licensed providers. They would still tell you in Otsego County when you talk to a young family that they struggle to find childcare. but it is half that number in every single one of the other counties that we work in and that we serve. So the number of safe childcare providers really limited in our area. And then the cost for childcare, hugely expensive. And a lot of times these numbers, this is a median number. So there are some that cost much more than this as well. A lot of, you look at the DHHS assistance, so assistance to get childcare here in our community really is based on your income. And what we tend to see, we've talked about this a little bit before, is that working poor. So you have one parent that is working, and if the other parent goes to work in order to afford childcare, then a cost that it costs to afford childcare, it also kicks them out of the ability to get assistance. And so they are there's no reason for them to work because they are actually costing them more money to work. But then how does that impact our community? We don't have workers, and the number of open vacancies in our communities is exponential at this time. I'm going to share a quick video that gives you.
That's me at 4 months old. I'm one of the thousands of little miracles born into poverty every day. That's my mom. She's 17 and never finished high school. She's got some big dreams for me, but she's alone and she's scared. This is my first birthday. That's my grandma, my cousin Tanya, and her boyfriend Kevin. We all live together. It's cold and crowded. I hope we move soon. I don't like Kevin. He's always yelling. This is my second birthday. We're all at daycare, strapped in watching TV again. I wish I could just run around. This is my third birthday. My brother William's taking care of me while my mom sleeps. She works the night shift, so we can't turn up the TV, but we get to go to bed whenever we want. This is my fourth birthday. We're sleeping at my aunt's this month. I don't know when my dad's coming home, but I'm hungry and I miss him. This is my fifth birthday. This is my first day of kindergarten. I'm tired. I'm hungry. I'm unprepared because I didn't get the right start. I'm twice as likely to be in special education. 30% more likely to never go to college. 70% more likely to be arrested for a violent crime. Become a teen parent. Drop out of school. Never hold a job. Spend the rest of my life in poverty. My mom plays with me all the time. She smiles a lot now, and she knows she's not alone anymore. Grandma, Tanya, and Kevin read me a story every night before I go to bed. I go to my school every day, where I get to run and play and see all my new friends. Will and I go to preschool together. Today we learned about dinosaurs and played a counting game. Every morning, my dad and I brush our teeth and eat breakfast together. We have our own place now, and I know we'll always be together. This is my first day of kindergarten. I'm rested, I'm eager, I'm confident, I'm curious, I'm prepared. I'm ready. I am your future. changed the first 5 years, and you changed everything. Anyone interested in investing?
So that really is why in human services, we're so passionate about what we do, is really the impact that you can have on those young children. And this kind of gives you a visual representation of what the impact of growth development during that amount of time. So you're looking at a newborn, and these are the synapses in the brain, the amount of connections in the brain. And at a newborn compared to a 1-month-old compared to a 2-year-old, in the amount of growth that happens at that young age range is just exponential, and such an impact that you can have during that time.
I didn't know how to take care of no baby till they I would ask them. I mean, if it wasn't for them, I wouldn't know.
So looking at the home sales in our area, and this is information that I was able to gather through December of 2021. The median price for a home in Charlevoix County compared to Sheboygan County, as an example, and a lot of the families in our home, and this is a whole county picture, so it isn't a city to city picture. I'll break it down a little bit later on some other data, not specifically home sales, but really just that varying amount in order to purchase a home in this area, what type, how much it's going to cost you. When you look at the population, and I just picked Charlevoix County for sense of time, but what's interesting about the population are in Charlevoix County, it has grown a little bit from 2010 to 2020. However, the age breakdown is where it's the most drastic. So the number of young families and younger individuals in our community has gone down, where the number of 45 plus has gone up. When we look at the percentage of students who are qualifying for free and reduced lunch, so again, this number is very underreported. Your middle schooler and high schoolers typically will not apply for free and reduced lunch because there is a stigma to that. They don't want to be seen as the individual that gets free and reduced lunch. And so this is that breakdown a little bit further. So if you're looking at Boyne Falls, it's a little bit cheaper to buy housing in Boyne Falls. They're at 70% free and reduced lunch compared to Petoskey, where it's more expensive for housing, yet and therefore you're seeing the less percentage of free and reduced lunch. One of the things to think about that, so you're having to purchase housing outside a little bit further, but your job is in Petoskey, but you're buying a house in Alanson. Typically these individuals, 50% of our population, their car might not be as reliable. They have to pay for more gas in order to get to their job, in order to continue to work. This data is slightly old because in 2020 and 2021, every lunch was free due to the pandemic. So the numbers are from before that. When we look at the rental cost in our community, and again, these are rental of a 2-bedroom. We know that the numbers can be higher, much higher than this, unfortunately, in our instance. But in Charlevoix County, average monthly rent, $800 a month. So you have to be making $1,558 in order to afford that and still be able to have adequate income to live.
Kinds of behaviors that are going to bode well for
there's a lot of talk about poverty. What is a poverty level? And so I just threw this in here for your information to look at. If somebody's talking about you are at poverty, you're a family of 4, you can make up to $27,000 and you're considered at poverty. Then there's a percentage of poverty. So a lot of programs in our area, whether it's through the health department or other human services, there's a percentage of poverty because we recognize that even if you made, as a family of 4, 49, almost $50,000, that would be really hard to live on and to be able to support your family of 4. So our WIC program, as an example, you qualify for that program if you're at 185% of poverty.
Graduated high school.
When we look at the median household income, again, this is county level data, but this is our 2020 numbers and the $20 and what the median household income. Emmett and Otsego County, the median income is just at around $56,000. So you go back to your housing costs and your rental costs, and what does that mean for families in our community? The unemployment rates, I think this is very common to most of us. We have huge unemployment percentages when we're looking during the winter months. We are definitely a tourist town, but what does that mean for the, 20% of individuals during that time that have unemployment during the winter months? How does it impact them and their families?
Confident about learning.
Back to some alcohol use, again, greatly underreported when we look at this, when teens are doing it, but the numbers are just so staggering to me, knowing that it's underreported, yet the percentage of over 15% of students under the age of 13 had their first drink. What does that mean in our community? How is that impacting our schools, our employers, so on and so forth? When
And there's no question that a supportive adult that really understands the
how do you close that? Okay. Sorry about that for anyone online. All right. So we're back. So this is looking at the drug use numbers. So those that have tried marijuana in our schools, staggering numbers. Again, when we're looking at this is where a lot of our safe work, I know Susan presented on that before, the Lock It Up campaign, a lot of that comes from this data in order to keep our teens safe in those instances. Oh, no, it's not working. Hang on. There we go. All right. So teen pregnancies numbers from 2019 in our area. So the number of births to teens under 20, the percentages aren't high, but the impact that it has on every single mom and significant other in this category is astronomical. When we look at our youth depression and suicide, this is state of Michigan numbers, not our specific ones, but the number that made a suicide plan, 15% of the teens in our state have made a suicide plan. Over like 8% have attempted suicide. And those numbers are just so big, and it's, such important work to try to decrease them. And so when we really think about what does that mean for the Health Department of Northwest Michigan, what is the work that we do, that really is the role of public health, is to promote, protect the health of our community. We have to know what our community looks like in order to be able to really make an impact. And many of the programs and services that we provide can, as I've shared throughout the presentation, is really looking and targeted to be able to meet those needs of the individuals in our community. Thank you, and I'll take questions. Yeah.
Probably not exactly a point you'd probably look for, but I'm curious about some of these statistics. Especially when it comes to teen drug use, alcohol use, and so on. And when we talk about the family nucleus, I wondered how many of them are in broken families. I'm curious. So it'd be a good statistic to look at to know where your target is.
Right. Yeah, additional data to be able to do that. And I know that we don't have that from the local level. I could definitely look to see if there's evidence out there. What do those numbers look like more from a state or a national level?
So on page 12, you have Sheboygan County instead of Otsego County. Is there a reason for that, or?
I just couldn't find Otsego
Okay.
County numbers. That's why.
Yep.
Yes. Yeah, great question. So one of the advantages that we have in our area, we've talked about it a little bit more, is the partnerships that we have with other local health departments too, because it is so hard to make an impact in just one individual community on such a large problem, right? And so being able to work, so we have a maternal child health work group, and that's one of our focus areas, is looking at the smoking numbers. And we aren't the only ones that are doing this. A lot of that comes to, we partner with, we have a Northern Michigan Perinatal Regional Collaborative. So that has hospitals, all the different human services in this area to be able to say, this is a huge factor. What can we do about it? So different initiatives. Back before COVID, we had something called Script. So it was a training that we had put our staff through. Hospitals had put their staff through. Doctors' offices had done the staff. So the same message, that same script is being provided and the support is being provided. There's tobacco helplines, there's quit lines, it's where is the individual at? How can we meet them at where they're at? And how can we, when they're ready, be able to educate them and steer them in the right direction?
I suppose that's 30-some% that smoke while they're pregnant. That's very.
And if you looked at the Medicaid population, it's about 50% that smoke. If you have Medicaid when you deliver, it's about 50% of those individuals that smoke during their pregnancy. So a large population of those that's what our nurses are out doing when they're doing the home visits with these moms. We get them on during their pregnancy. We provide WIC services during their pregnancy. That's a lot of the education. Some of them, maybe we can't stop the smoking because it is such a hard thing, but can we reduce it? If they were smoking 10 cigarettes a day, can our goal be 8? And then maybe the next time we see them, maybe we can get to 7. Every opportunity to drop, and it might not be to the very 0 you are fully quit, but every opportunity just provides that much more growth and opportunities for a healthy mom and baby.
Yeah, I had a friend who smoked, and it's very difficult to quit. I'm sure you look at it, but one of the answers is to try to get them to never start, which
Yep.
you have to start at that.
Absolutely.
and
Prevention
If there's
within.
any way we can keep them from ever taking that first one, I mean, they don't even know the grief that they'll save themselves later on in life.
Absolutely.
I think a lot of us are at an age where we remember that when we took health classes and driver's ed, we saw the results of what your habits do. You saw the car accidents and how bloody they were and how bad they were, and it scared you not to drink and drive, right? And same thing when it goes to drugs. You know, our classes used to show the results of a baby when you did smoke, what happens to them, or when you did unprotected sex, stuff like that, all the diseases you got. My kids said they don't get that kind of the kind of graphic stuff we got, which scared me into not doing that. I'm wondering if we still have those practices to show a mother, I mean, this is the result of a smoking baby. Do we still do that, or we just kind of talk about it? I mean, I don't know.
Yeah, I think it's a combination of both. Are they as graphic? You know, the world has changed a little
Yeah,
bit more
for the
about what you
worse.
can do or not, so, what are the tactics that you can do and talk about? We talk a lot about pictures of a brain and what a brain looks like of maybe a smoking baby versus a full-term baby that didn't have smoking. So what is a visual that we can provide them that they're able to kind of resonate with to help them when they're making those decisions to have that cigarette or not? And
I'm just going to add, I mean, obviously the issue, and Jairus brought it up, is I doubt very highly that there's any mom who finds out she's pregnant and says, oh, I'm going to start smoking because I'm pregnant. I mean, if you want to stop moms from smoking, you have to go upstream, like you said. And that's where the programs that are community health programs, the SAFE programs and other programs to try to make sure kids are educated about the risks of smoking and vaping. And there was a lot of headway with that, and childhood and adolescent smoking was going way down, and it still is down as far as combustibles. But with the vaping, we've really gone backwards there. And there's a lot of things we can do as a society to reduce smoking in our kids, and that initiation so that they just don't start, because once they're hooked, it's so hard. But that's a whole nother discussion, and really takes a community and a society effort. That's something that's hard to address right at the health department level.
Impossible to address at the health department level, Doc. We have a society that now thinks it's great for everybody to smoke weed. We don't hear the negative part about you're still sucking junk into your lungs, but now we've made marijuana legal. So I'll get off my soapbox for a minute. Thank you, Amanda. Any further question for Amanda from the board?
I just want to say, I recalled the movie that I watched in Driver's Ed. I can even tell you the title of it. It was pretty graphic, which for me.
Okay. Thank you, Amanda. Mr. Thorell.
Yes, thanks, Amanda. Good presentation. So the next item on my report is the employee compensation plan for fiscal year 23-24. So the employee committee at the Personnel and Finance Committee on June 28th presented to that committee. And just as a reminder too, it's normally a 3-year plan, which would have started last year. Last year, it was decided that just 1-year plan was presented just due to just the uncertainty around the pandemic and everything that was going on. And so the employee committee came back this year for the additional 2-year plan, which was agreed upon at that time about a year ago. So they did the presentation. We worked with them, health department administration worked with them to come up with a feasible request, in which I believe that they did. They presented it to the Personnel and Finance Committee. They voted to recommend it approval to the full board, and that is what we're asking for. And I guess I would ask Rob, if you have anything to add to that with the Personnel and Finance Committee.
It was brought, like Dan had said, brought to the Personnel and Finance Committee. We agreed to the 3% increase and the for each year, and then the one floating holiday, non-accruable holiday. However, we had a sticking point. It was an increase to the county's appropriations. We agreed that our economic conditions, the high inflation rates, that the counties could not absorb that at this time. So our agreement was to allow the COLA increase and the floating holiday with I guess with the caveat that we would hold county appropriations at same as last year as well.
Point out, it looks like a couple of
that's depending on, and Mr. Farrell, that's the population, the census.
Right,
correct?
yeah. And I'll get into that in the next item of my report. And we can talk more about that, but yeah.
So before you move on there, Dan,
Mhm.
We are 2 members of Charlotte County, 2 members of Emmett County, 2 members of Antrim, and 2 members of Otsego. And my understanding from the employee request last time was that it was a $40,000 increase for local appropriations. Has that been removed?
It's the increase is across the entire budget. And that's part of what I'm talking about in the county appropriations. It's not a $40,000. I think that was a misunderstanding. It's really 6% of our budget is local appropriations. So I think, looking at that, spreading it out over the entire budget, it's if you want to make that connection, it's 6% of that, right? So what that number actually is, I think it probably is more like 20-some thousand, maybe, if we were making that connection. But I'm not, because local appropriations are a percentage of the budget. I'm just, it's basically that increase is spread over the entire budget. It's not, we're not saying it's coming from individual counties or not, but you could make that connection, I guess, based on if you did the math.
My point being, let's say hypothetically, we all say, yes, this sounds great, we approve it.
Mhm.
And then the counties come back and say, no. We're 2 members of a 6-member board. If our county doesn't agree to any additional local appropriations, then what's the plan B?
Well, we're not asking for any additional over last year.
Okay, that
Right.
was my initial
Right.
question. Maybe I didn't say it right.
Right.
looking at it here, yes.
Yeah, you go down
And,
277 to 272.
right, so let's say that Otsego says no.
Mhm.
You understand, regardless of which county it is, I'm saying that Charlotte County has asked all of its department heads, and I think I shared this with you already, Dan.
Yeah.
For a 10% operating cut. Not in personnel, but in operating budgets, and that's gonna be difficult for them to do, but that's where we're at. So, I understand that Charlotte County goes down. I'm looking at all four counties. I'm trying to look at the big picture.
Sure that this increase in wages has to be approved at the county, each individual county level. I don't think there's anything that would-
Go ahead.
I happened to be at that meeting too, and it was like, we were being all discussed it, and it was like, it wasn't anything coming from the county. Because the doctor wasn't so they had, whatever the amount was in their budget. So we want, they're gonna have, kind of, we did have to come up with that, we just have to put their budget into that. And it's,
That is correct. We've identified some funding, and Andrea Pierce is here. She can go into that. I think she was prepared to talk about that a little bit.
Before you do, Andrea, and I appreciate that, I don't want to sound like the stick in the mud guy that's saying, no, you're not getting a pay raise, because that's not where I'm at. I appreciate our staff. I appreciate what our staff does. I just want to be realistic about what the local appropriations requests are going to be.
Sure. And actually, I mean, there was a lot of discussion. I think when we initially went to the Personnel and Finance Committee, and I believe you and Commissioner Rubin were in the audience. At that time, we were still formulating, looking at our budget, what do we need? And we're all faced with these, huge increases and due to inflationary pressures across the board. And really, at that time, okay, so do we ask for what we asked last year? Is it 3%? I think that was what was talked about. And then we, scaled it down to 1.5. And then, really looking at, all the hardships that we're all kind of facing. It just seemed fair to just hold everything zero, at 0%, because we're all in the same boat, right? And we identified some areas of funding that we're getting from the state that can help us, workforce development dollars that can help us with employee increases that, really have to do with staff retention and recruitment, which is a problem for health departments across the state. And so really, I think it's a kind of a twofold, recognizing that counties are in the same boat that we all are. And we understand and recognize that, and holding appropriations at 0, and also, looking at the staff, because when they first came to us, talking about what the actual, cost of living is, there's no, we can't do that, and I think probably the counties are in the same boat too. You just can't do that. It's just not, we don't have the money to do it. So we're just trying to look at all different facets and where we can just be the most fair and reasonable. And I think we came up with a good plan.
I appreciate you taking the time to elaborate on that. I would point out, I'm not aware of this for any of our 4 counties, but there's one county, I believe it's Isabella, that their sheriff's department doesn't respond anymore because they've gone through their gas budget. Unless it's a crime in progress, they don't respond. And you're right, every municipality, every governmental agency is dealing with all those increases.
And Emma, for what it's worth, we haven't reached that point. I'm sure it could be out there, but in the budget is a 10% increase for the sheriff's deputies, because he said he's tired of running a driver's ed program, hiring deputies, training them, and would leave for someplace else. So it's a 10% increase in the first year. Now that's different from the rest of the county, but it's pretty darn serious. And for what it's worth, the medical care facility is so short-staffed. that it's had a dramatic impact on the ability of the staff to bring in patients that bring in revenue. And the facility is in a pretty serious financial difficulty. All of these things are coming together.
Right. Mr. Coons. So, my understanding, this has been approved and recommended by the committee. Yeah. Facing an issue with employee retention. Not gonna cost our county then with an appropriation. As we see and are presented with the value of the service provided by the organization. Probably.
Yes.
Yes.
Do we have, certainly, go ahead.
I think, would you explain to the rest of us what it's coming from, if we don't.
Yeah, and I'll let Andrea Pierce do that because she's the money lady.
Thank you. Is this on?
It is. Thank you,
Yeah.
Okay,
Andrea.
thank you. Well, the first thing that we're doing is right now, we're currently preparing and submitting our fiscal year 2023 budgets to all of our different grantors. And so within those budgets, we will include the approved increase. So we have an opportunity to receive those additional funds for staffing from many, many of our grants. Our state grants tend to not increase much, but we work with a lot of other grantors besides the state of Michigan who tend to normally give us those increases as we ask for them, or we will be reducing other costs within that budget to meet that increase. After that, if we have like the state grants and items that we cannot get increased funds from the grantor, we have two specific areas of funding that we have identified. The first is from the state, and it's a workforce development grant that is specifically for this type of situation to be able to put money into the workforce at the health department. And then we have another funding source with amounts available, and the wording is for creating and maintaining a competent workforce. When all three of those are put together, it does cover the cost of this increase.
When will you know about approval on those, Andrea?
We generally know by the beginning of October. Most of them will be sending out, some of them have already gone out and we have put in the anticipated increase. But again, even if several of the ones that we have requested an additional amount were to deny that, these other buckets of funding would cover the increase.
Okay, thank you. I was looking at you, is there, Mr. Marcus?
I just want to better understand, make sure I'm following the discussion correctly, because there wasn't a real motion from the committee here for me to review and look at. So I'm sorry. I just want to make sure I knew what the actual motion was that you're discussing. Was it a 1 year or 3 years, a 3% COLA plus the float? Is that right? What is it?
It was 2 years, so fiscal year 23, fiscal year 24, 3%. And then the floating holiday would be in effect for fiscal year 23.
Okay.
It's not accruing, so you use it or lose it,
And then one more thing is what I'm looking at in this one sheet with the appropriations requests in dollars and the per county. The way I'm seeing it right now, Antrim and Charlevoix, based on their population requests, their funding requests would be actually that much money less. Am I reading that right?
Yeah, so there was because of the 2020 census and the numbers that came out with that. And, I know in Antrim County, you guys have dealt with that because of your redistricting. Excuse me, I can't talk right now. Anyways, so for calculating appropriations for the district, we use those same population numbers, and there's a slight decrease in Antrim and Charlevoix counties percentage of the whole for the 4 counties. So where Antrim and Charlevoix went down in that percentage, Emmett and Otsego went up.
Okay. The other thing I'm thinking of and looking at through our slides and our discussion was the population, birth rates, everything going down, which obviously in 2 years from now, even this year, you're going to start seeing a reduction in services because you not have as many families that are having babies, right? So there's going to be a reduction in that service. This is my thinking on if you expand, as this is just employment.
Mhm.
This isn't the budget in general for programs. But with one county already cutting budgets across their board, knowing what's going to happen this coming year in their budgets, I'm just trying to figure out how you can justify growing a budget and expense with a reduction in services, and being told that we give us this dollar amount through the budget, but we can recoup it through grants. Does that mean we get it back, or is the budget just continue to grow?
Well, I mean, to your point about services and for young mothers and children and things like that. I mean, we are seeing some reduction in those numbers, and we have not filled a few positions. I believe we didn't fill 2 public health nurse positions. Is that correct, Amanda?
Yeah, similar to
Yeah.
that. So I have a whole, like that's part of my role is a whole staffing structure that really looks at the number of caseload that we have in all of our programs and what are the staffing metrics that you need to have in order to serve that. And then we fill or replace employees based on that. So we have not replaced a couple public health nurses, a couple public health techs. That's just my division in the certain program that we do.
Yeah. So, I mean, we are constantly evaluating, looking at those things and, what kind of staffing we need. And quite frankly, if somebody, if they leave for whatever reason or retire, we look at that. Does that position need to be replaced, or do we shift things around? We try to be as fiscally responsible as possible.
Thank you. The other last question is the reference to approving the increase, but then having access, another means of getting the money through other means, through grants. Why aren't we doing that first? Or
That's what Andrea was.
well, that's why I was kind of confused. I want to make sure I understand. Is this something that's happening simultaneously or based on whether or not it's approved, up or down vote? Because if you get the money through the board vote and we approve it, and then they go out and get money from outside source, what really happens is there's unaccountable money out there that makes us, why do we give an increase when they could have got it somewhere else? I'm just trying to figure out if there's money being put away that's could have been used somewhere else.
Yeah. So basically when we're applying for in those grant cycles, when we're applying for those grants, we're putting in like how many staff would be in those particular programs. And then we put in the wages and the fringe benefits and those type of things. So if it's, it increases, then we put those numbers in. And then that is part of the grant proposal that then goes to the grantor and for approval or not approval, or, however much they end up giving us. So and that's typically, I guess, I think what Andrea was talking about is historically, as all health departments do have been increasing cost of living increases and whatnot. I mean, it's typically what is done, keeping pace with employment and some of the things that we do.
I would also add that with most of the grant,
You just got to talk closer to Mike for me. I can't.
sorry about that. With most of the grants that we were discussing, they are, the way they work is it's a reimbursement amount. So if it's not spent, we don't get to keep it. We give that back to the grantor. And I think if I understood what you were asking, it was if
the county is giving us the money for this increase, and then we're getting these grant funds as well. And I think what I was trying to explain is that the local appropriations that we get are not used, and we're not asking for those local appropriations in any given year to pay for any increase in the salary. As a rule, those go for matching dollars that are required, and they get used for other general costs of mostly required or the basic services that the health department provides. So it wasn't that there's both. I believe my understanding is that the board approves our request for these increases to our employees, but it's separate from the county funding, the local appropriations. They're really two very separate issues.
Okay, but Andrea, you understand that the way it was presented at the Personnel and Finance Committee was that it was a $40,000 increase to the local appropriations. That's the way it was initially presented to us.
Yes, and that was probably my misspeaking at that time. That first meeting that we had, I had discussed with Dan what information I should be prepared for. And at that time, it was discussed to have generalities of where our funding increases tend to come from year after year after year. If we get them from grants or we get them in local appropriations. And so I was throwing out several different places where money comes into the agency, but not necessarily specifically what would pay for this increase. So I apologize. I believe that was me misspeaking.
Okay, thank you. Any further, hold that thought. I know you want to, and I know. I'm looking at the clock too. Any further discussion regarding the employee compensation plan for fiscal year 23? Ms. Roloff.
Is everyone, you know, exactly what it's called? I mean, I have people to raise their hand, those that know what's really being discussed here. Because I'm sitting here, I went through that other meeting, I'm going through this one, so we just went to the hospital and one for the employees. We discussed all that, and we were gonna be next year. And now we got it formally, and I'm here to let it happen, and it's still not explain it for me. Again, I'm just kind of like getting over and whatever. So when we say, and I think Holly, you're the one that said it. And she told us that this will not come out of the county fund. You had put aside for the health department, and you had funded for that. That we could vote on this. There's nothing coming out of the county. So
Correct. Correct. Yes. I think that's where we're all at. Okay. Any further discussion? Mr. Koontz, make your motion.
Okay. Thank you. Okay, so I move that the board approve the pay increase for that department. Employees fiscal year 2022. And fiscal year 2024. And the addition of one.
Non, or no, one floating holiday, but
Not accruing.
not accruing, excuse me.
Right. For 20, yeah,
Is that per year?
Yes,
just the one holiday.
right.
Okay.
Yeah,
So-
so it goes away if you don't use it, it goes away.
Okay, so I'm gonna ask you to withdraw and remake your motion, so we're crystal clear on it.
Yeah.
Thank you. Been moved by Mr. Coontz. Is there a second?
Second.
Seconded by Ms. Powers. Any further discussion? Jennifer, can we have a roll call, please?
Rubing,
Yes.
Marcus,
Yes.
Roloff, Hankins,
Yes.
McInnes,
Yes.
Coons, Pallarito,
Yes.
Powers.
Yeah.
Thank you.
Mr. Thorell, you can continue, sir.
Right. So we kind of went back and forth into some appropriations discussion, and I did talk about some of the things that I put in this report, but just going back and just recognizing, we're all in kind of the same boat with this inflationary pressures that we're dealing with. And I gave you the kind of what we were looking at, and we decided to land on a 0% increase. There was a couple of reasons. One of them being the inflationary pressures and increasing costs for everybody. And also the fact that we were doing this recalculation this year based on the 2020 numbers, which, may take some counties a little bit, by surprise. I don't know if that will or not. But just that is something that was looked at. And on the back page, or the, item number 3 there, I have some tables that show what the request in 2022 was, where we're at in 2023. And as you can see, some of them go down, some go up. And that is how it shakes out with the 2020 number. So I didn't know if anybody had any questions specifically about that. I put that information together, just trying to make it so it was clear as possible, but.
No, I think it's pretty straightforward, especially your bottom graph there, showing the increase or decrease over 2022 required support.
Yep.
Yeah, I
other-
mean, you just look at the total population. 2020, we're at 108,688. 2010, we were at 106,387. Antrim County went down. Emmett, not Siegel went up, so it changes how it shakes out, but
Yes.
Okay.
Yes. And with that, I gave you all a handout about public health finance, and just wanted to go through that really quick, just about local appropriations really quickly. As I said before, local appropriations are about 6% of our budget and sources of revenue. And this is fiscal year 21 numbers, but they're really important. 6%, they support multiple agency programs that it includes the essential local public health services. We have cost sharing that's required for many programs, and then also matching. When matching is available, we can increase that funding amount. So, and I go into that a little bit farther in this presentation here, but so we can utilize unique funding mechanisms such as Medicaid outreach and Medicaid cost-based reimbursement due to the population served. We provide services for those in the community that are not able to access care from private providers or need additional support not offered by the providers. There's many providers out there that do not accept Medicaid, and we fill some of those gaps. But I think it's really telling in the chart that's on the next page about, basically how much that really means. And this is for fiscal year, estimated for fiscal year 22, actually. What we put in, a local amount that's eligible for a match, $770,613. We would get $1,182,042 from state match. This is a 2.53 increase over every dollar that we put in. So 68% of local appropriations are matched that we receive. So it's just I think it's just really telling that we can bring that many more dollars into the community from those local dollars that we put up. So Another really interesting bit of information that I was able to find is through our Michigan Association of Local Public Health website. This is a little bit older information, but I don't think it's changed really much from fiscal year 2019, is just the percentage of local appropriations as part of the budget for district health, the district health departments that were on that page. And we are, Health Department Northwest are lower than virtually all of them. I think we are the lowest one. And actually for fiscal year 21, the local appropriations are 6% of the budget. And I think this is really a testament. We keep local appropriations low by seeking grants and forming innovative partnerships. And we've always done a good job at that. And staff have always done a good job at that. And I think that really is a testament to their abilities there. Another interesting thing, the per capita investment from local appropriations was $10.07, which helped produce $160.80 in health department services. So it was basically just taking that number and dividing it into our budget and our revenues. So, I mean, that includes like the building and facilities and, the power and everything. So, but it is, I think, a really good investment in the community and it just shows what those local appropriations, the power that they have. Multiple studies have shown when people are connected with services that prevent adverse health outcomes, the overall cost of healthcare in the community is significantly reduced, and it's more of just catching things upstream. And that's really what we excel at in many different ways, including environmental health. So no pun intended, but anyways, so local dollars used in matching programs help support healthy pregnancies, children, moms, families during a critical time in development. I think that's just a really important piece. And we've touched on that a lot in this meeting and with Amanda's presentation, and just really grateful for the county's continued support. And just wanted to give you a picture of how that money was being used.
Thank you, Dan.
Yeah.
Does the board have anything else for Mr. Thorell or any staff members?
I got
Hearing none.
I got a couple questions.
Mr. Rubin.
Yeah, this is on Holly's workforce development. The second sentence, you talk about diverse areas such as health education, community health, public health, laboratory science. I'm not sure. I don't know what public health laboratory science is. So could you?
Sure. So I think that the Northern Michigan Regional Lab, that is what I was getting at, is that's a public health lab that we have in our jurisdiction, which is really unique.
The one in Gaylord.
Yes.
And then Dr. Meyerson, on your report, do we know, did we have a flu outbreak in Otsego County or do we not know?
That is interesting. I have a feeling, the flu-like illness was probably came from, usually most of those come from school reports. And I'm going to be honest, I didn't notice that until Jeremy pointed it out to me. And it may have been that Otsego County was reporting in June and the other schools hadn't. So, we certainly had late flu outbreaks, and we did have some flu outbreaks later in the year in some of our congregate care settings and our schools. But I don't think there was anything particular in Otsego County overall.
And then I have a couple questions on Kathleen's report. Is she here? There she is. First of all, the last page, Emmett and Otsego are exactly the same. Is that correct? Or is that, it seems kind of odd because we've got total visits and we've got total unique users. So it seems a little, it could happen, but.
That is not correct. I copy and pasted the formatting and apparently did not update the number, so I can get those to you guys.
Okay. And then if you compare, like, say, Antrim and Charlevoix, if you divide them out, we're talking about community health and mental health visits, correct?
Total in
Yes.
those numbers, yes. Yep.
So if we have 642 and 3,633, that's either 5 or 6 visits per user. And if you go down to Charlevoix and you divide the same numbers out, that gives you 7 to 8 visits per user. Is that? Can you explain that a little bit to me?
So I'm looking at the number of programs that we have in each county. Because for our mental health providers, for example, they're one person and their visits are usually a half an hour to 60 minutes. So they're really time limited at how many people that they can see and how many visits that they would have in comparison to like a school wellness program or a full clinic that would have a nurse practitioner or RN who might just see a student for 5 or 10 minutes. And those visits, so they would, in theory, be able to get a lot more visits in a year compared to a mental health professional. So I would have to actually look at the number of staff we have in each area, because some school programs, we have multiple mental health professionals, and that's not really.
We're not comparing
recognized
apples to
here.
apples is basically what you're saying.
Correct.
Different.
I have all the little details. If you'd like them, I can get them to you.
And then your second paragraph, the services provided through these programs do require parental consent for all non-confidential services provided according to Michigan law. Do we know what the percentage of parental consent versus the ratio or the numbers are for those?
I don't know the number off the top of my head. I'd have to have that. I'd have to have that looked up. I can just comment on that our providers do try to call, they do call parents for consent if they don't have one on file. If it is a non-confidential service, we're required to have that consent. If it is a confidential service, that's going to be the group of kids that might not have a consent from a parent. But I've talked to many of our providers, and I can't say this is true for everyone, but they see a handful of kids a year that don't have parental consent, that are seeking services under that confidential Michigan law. But they do work with the student throughout their sessions in order to bring the parents in, because often it's an issue that you need your community. So the number of kids without a parent consent is not really representative of non-parent involvement.
Yeah, I mean, I'm just thinking as a dad, if I don't know that one of my kids is having a problem, there's no way that I can help them with the problem. You know what I mean?
Exactly.
And sometimes as parents, if you've got 3 kids in school like I do, and they're bringing home 3 different reports, sometimes something could get dropped. We're busy people too. You know what I mean?
Oh, yeah. Yeah. And we do have a policy even written to support that is if a student comes in seeking confidential services, our providers do work with them where appropriate. There are situations where it wouldn't be appropriate, but in those that are appropriate, they do work with the student to try to get that parent or guardian involved.
So if we have a kid that doesn't have a parent involved for whatever reason, is there a way we can get a church involved? Or, the more community we have with a troubled youth or a troubled child, I mean, those are the kids that need the most attention. You know what I mean? Do we have a wider circle, I guess is what I'm saying. I mean, I know my church and different churches have outreach programs for kids. Central Lake, they have the Baptist church, they have a bus service that will pick kids up for a weekly thing. And it does seem to make a difference. Some of them really look forward to those programs, you know.
Mhm. Yeah, and I think that's something that all of our providers are really good at is seeking out other community supports and working with the kids or the parents or families in general and trying to get them supports where possible. So our providers for mental health, our providers see kids with mild or moderate diagnoses. So they're we're serving a little bit different of a population than like our community mental health. So I guess that's the end of my statement.
Mhm, mhm. That makes sense. Thank
Yeah.
you. Thank you.
Mr. Marcus.
Commissioner Rubin pretty much hit a lot of my questions, so I just had one. You said you do have the ability to get those data marks. Could you please get that for us? So we're going to see how many kids are seen in confidentiality and how many actually, where the parents do get involved in hard numbers. Because that shows success when they're, and I want to see that successes is what I'm looking for.
Okay, so just to clarify, you'd like the number of students that see our providers under that not that
Confidentiality.
under the confidential visit, but then also how many of those turn into a consent, like a
That's a
consented
great number
visit?
to be looking at too.
Okay.
But obviously, those are two things I want to look and see whether or not there is that graduation to where there is involvement and not just more community involvement. I want to know whether or not the numbers are actually tracked for family involvement.
Sure,
Thanks.
I can work on that.
Mr. Pallarito.
Yes, Mr. Chairman. I just wanted to mention, in our packet, board packet, on the backside of our compensation proposal for fiscal year 23-24. And I asked Mr. Thorell, to include it in this packet, but right on the back, you'll find the health department fundamentals. It's 25 points. I just would urge everybody to take a reread of that. It's good stuff there. So there you go, right there.
Thanks.
It's got a green banner, fundamentals at the top.
Well, and that came out of
Thank
an
you.
issue where Jairus was reading a document where he saw the capitalized on fundamentals and wondered what
Yes.
that was all about. And this was in direct response to that. That is a document that is not just a conversation. It's a very specific document.
Yes, yeah. And I think it was the job description that had a lot of the fundamentals incorporated in the job description and really, right. So,
Thank you, sir, for putting that
yeah,
in
no,
there.
thank you for
That's
bringing that up.
good
I was
information.
definitely.
Anything further from the board? Hearing none. Item number 10 is committee reports.
I make a motion, the finance committee met and recommends approval of the June bills in the amount of $594,162.85 and the June employee expenses of $20,857.08.
I'll second it. I don't care.
I think I heard Mr. Marcus first. So it's been moved by Commissioner McGinnis, seconded by Commissioner Marcus. Any further discussion?
Just wondering, Dan, do you know, are we still spending money on ads for vaccines for COVID, or is that coming to a stop, or do you know?
I am not.
Yeah, but that's the state. Thank you. Yeah.
Oh, my goodness. Yes.
Yeah. I was gonna
Yeah.
say, I
Thank
thought it was
thank
a
you for
resolution.
reminding me.
Yes, yes,
We do have a motion on the floor right now before we,
right. We can go back to Mr. Thorell in just a moment. We have a motion and second on the floor for the Finance Committee accounts payable. Jennifer, we have the roll call, please.
Roloff, Hankins,
Yes.
McInnes,
Yes.
Coons,
Yes.
Pallarito,
Yes.
Powers,
Yes.
Rubing,
yes.
Marcus.
Yes.
Thank you.
Going back to Mr. Thorell for one item that was bypassed but not overlooked and certainly worthy of our recognition. So go ahead, please.
Thanks to Amanda. Thank you, Amanda. Yeah, I know. Yeah. She's got T-ball kids waiting for her. So in this case, Linda Moore is retiring and it is it is the practice of Health Department Northwest to present a resolution, and I will have Lynn's director Kathleen will read that resolution to the board.
In an official session on July 5th, 2022, the following resolution was unanimously approved by the Health Department of Northwest Michigan Board of Health. Whereas Linda Moore has provided over 16 years of service at the Health Department of Northwest Michigan as a registered dietitian, nutritionist, and community health coordinator, sharing her love and enthusiasm for health and wellness with people of all ages. Whereas Lynn's passion for health has been integrated into all of her projects over the years, first providing nutrition education services to new parents and young families through maternal infant health program and women, infants, and children program, working with mothers, infants, and children at nutritional risk to achieve positive birth outcomes and childhood growth and development. Whereas Lynn's dedicated work with Supplemental Nutrition Assistance Program, or SNAP-Ed, resulted in the ability for residents to use SNAP benefits at farm and farmers markets, increasing access to local produce through Double Up Food Bucks and supporting local farmers through Hoop Houses for Health. Whereas Lynn's knowledge and public health experience contributed critical expertise to many community initiatives over time, particularly including Building Healthy Communities, which sought to improve health and wellness of the community through nutrition education, cooking classes, and policy system and environmental change throughout our service area. Whereas Lynn's dedication to mental health, innovation, and grant writing expertise created the Mindfulness Ambassador Program in Emmett County Schools to provide students and teachers skills for self-regulation and stress reduction. Whereas Lynn's commitment to equity and meeting people where they are was supported through food access work and multiple grants for nutrition education, farmers market promotion, and farm to school initiatives. Whereas Lynn's ability to build relationships led to strong partnerships with both state and federal agencies and with local partners such as farmers market managers, farmers, and Groundwork Center for Resilient Communities, resulting in increased access to healthy and local foods. Whereas Lynn's dedication and willingness to increase health extended to her peers through our worksite wellness program, Live Well, where she coordinated efforts to provide monthly physical or mental health challenges to increase employee well-being. Whereas Lynn's dedication to implementing policy, systems, and environmental change strategies throughout the community will benefit individuals, businesses, and the community for a whole for years to come. Whereas Lynn has worked to promote health and wellness of the employees and community. Therefore, be it resolved that the Board of Health commends Linda Moore for her service and dedication, and on behalf of the department, its employees, and the people it serves, indicates its appreciation and says thank you. And be it further resolved that the Board of Health extends best wishes to Linda Moore for a long and happy retirement.
Thank you very much, Lynn. Is there a motion to approve the resolution as presented?
I'll make that motion.
Moved by Commissioner Pallarito, seconded by Commissioner Roloff. All in favor, say aye. Aye. Thank you very much. All right, ladies and gentlemen, that takes us to item number 11, which is public comment again. Same rules apply. You will still have 3 minutes to address the board. Does anyone from the public wish to address the board at this time? Going once, going twice, hearing none. Commissioners update, item number 12. We could just go around the table or around the desks rather. Mr. Rubin.
Yeah, just I'm seeing a few things come from the Michigan Association of Counties on budgeting, and I'm looking at Dan because I saw that the preliminary state budget is seeing an increase for environmental, primarily septic and well. And that looks pretty good. I'm just wondering if at a future meeting you could write us a couple sentences on things that you see. And
sure.
And I was also going to mention, I think Dan's doing a good job. got a lot that he's jumped into the last couple months and thank you.
Thank you.
Mr. Coontz.
Thank you. I'd like to congratulate the health department for having received the Director's Award for dedication to community during the COVID-19 pandemic. Premier Public Health.
Brought it.
I'd like to further I'd like to further acknowledge the former health officer, Lisa Peacock, received the Roy on Managed Distinguished Service Award. I was pleased to do this. To you for the recently. I'm personally grateful for the service provided to our community.
Thank you, sir. Mr. McKinnis.
Can I show you a picture of my granddaughter?
I prefer you showed me right after we called the meeting adjourned.
I have nothing else to offer.
Okay. Ms. Roloff. Thank you. Ms. Powers. Mr. Marcus.
Nothing.
Mr. Palrito.
Nothing, sir.
I have nothing either. I will entertain.
Move.
Move.
Seconded.
Seconded. All in
I
favor,
just wanna-
say aye.
I show you the Director's Award really quick. If you want to see it, stop by my
Well,
table.
that's awesome.
Thank you, Dan.
Yeah.
Okay, thank you, ladies and gentlemen.
Thank you, Scott.
Hi.